and welcome to Expanding Veteran Oral Health Care Delivery Beyond an Urgent Needs Model. I'm pleased to introduce Dr. Sean Boynes from Dental Medicine Consulting, and he is going to introduce our two speakers for this session. Dr. Boynes.
Thanks, Grace, and thanks everyone for joining us for this session. I hope that your day is going swimmingly. Today's session, which is Expanding Veteran Oral Health Care Delivery Beyond an Urgent Needs Model, will feature two speakers. The first, Dr. Teresa Chang, is a periodontist who received her Doctor of Dental Surgery, or DDS, degree from Kaohsiung Medical University in Taiwan and completed her periodontics residency at the University of Washington. She owned her private practice for over 20 years and is presently a part-time clinical assistant professor at the University of Washington School of Dentistry, Department of Periodontics. Dr. Chang is the founder of the nonprofit Everyone for Veterans, which honors combat veterans by connecting them to dentists in their community for no-cost dental care. She is the recipient of the 2021 ADA Humanitarian Award. Also, Ms. Jessica Elwell is an experienced nonprofit executive director with a demonstrated history working in human services. Her focus is in fundraising, donor stewardship, volunteer management, public speaking, conflict resolution, and event management. Jessica has been in the nonprofit sector as a volunteer and professional for over a decade. She is passionate about this industry and the unique opportunity to affect change and transform the communities that we serve. Turn it over to our speakers as we enjoy their presentation.
Thank you very much, Sean, for the nice introduction. And thank you to the American Institute of Dental Public Health and CareQuest Institute for this opportunity to share what Everyone for Veteran has tried to address regarding veterans' oral health. Am I on the video now? I mean, are people able to see me? Because I can't.
Yes, we can see.
Okay, sorry. There. Okay, sorry about that.
Yep.
So, okay, I should start with a disclaimer that I have no background in the field of public health, nor a veteran, and purely a volunteer. However, in 2008, after reading in the Seattle Times about a gravely injured Iraq War veteran, Rory Dunn, a graduate of one of our local high schools, and how his mom threw herself in to take care of him, I decided to reach out. Thinking that all veterans receive dental benefits at that time, I decided to give back to family caregivers of injured veterans to receive care. So thinking that all veterans receive dental benefits, I decided to give back to family caregivers of injured veterans with free dental care. After learning that only veterans designated with 100% service-connected disability are eligible for VA dental care, our office, of course, included veterans in our annual free dental care day in our office. Due to our limited capacity, we prioritize to care for veterans who have deployed to any combat or imminent danger areas, wanting to especially honor Vietnam War veterans who were excluded in many resources for post-9/11 veterans. So our discussion today will be from our experience with this population of veterans who have limited financial resources. I've volunteered with international humanitarian trips and local dental outreach clinics and mobile vans, providing urgent dental care. After each trip or clinical sessions, I feel good being able to contribute to folks who could not afford the care otherwise. However, I always felt that I haven't done enough. The concern that there are dental work that I could not get to at that one appointment, and oftentimes it's unknown whether that patient can take care of them before they cause pain and infection again for another urgent visit. Through all these experiences and conversations with hundreds of veterans, I've learned and realized the multifactorial challenges of veteran dental care access. The free clinic day at my office in Issaquah, Washington, leaves out many veterans who could not get to my office. The distance, limited transit and transportation, and even paying for gas are barriers. The free care event was held one day in a year, and that day and time can be a barrier. Many of the veterans work low-paying jobs where taking time off is not easy. And they have many doctor appointments that they juggle, and the day and time are prohibitory. When they do make the appointment, that appointed time may only be able to address the most urgent dental need that day. For veterans who we serve, the sliding scale fee clinics are still very much unaffordable to them. Or they may just pay for an urgent need sporadically. So in recent years, when veterans can purchase dental insurance through the VA, many of our veterans still cannot get their dental needs met because they cannot afford to pay for the portion not covered by insurance. Many of our veterans also experience these dead ends when they may go someplace where there is free care, but the free care was limited and they could not afford the remaining treatment. For these reasons, these are all reflected in the mouths of the veterans we see, where there's a lot of dental disease of tooth decay and periodontitis. What is most jarring for me is the realization that many of them did not and could not ever achieve a dentally healthy state in their lifetime, even as they are responsible working citizens providing for their families. The plausible way to remedy these factors would be to have care with a dentist in their community, addressing all their dental needs with mutually arranged appointments. As a periodontist, I'm used to collaborating with restorative dentists, so I would connect the veterans we see on our free Veteran Dental Care Day to a dentist in their community after we took care of their periodontal needs and multiple appointments. And that's kind of where we had all these conversations and how I learned about veteran issues. One of the first veterans we helped without screening or seeing the patient in my office is Garth, a Purple Heart Iraq War veteran from Muskegon, Michigan. I was really moved by his story and decided to help him. I'm very grateful that Dr. Betsy Bateman stepped up to provide free dental care for Garth. Garth had pain in a couple of molars and also reported being really embarrassed about his front teeth, which, as you can see, have been patched again and again because he could not afford care. Not only did Dr. Bateman address the problems with the molars, but as you can see, she also provided this beautiful smile. This case brought to light the willingness of dentists to give back to veterans and the willingness to provide comprehensive care. It also confirmed that we did not have to screen these patients for their dental needs, and that provided better efficiency in connecting the veterans directly to volunteer dentists anywhere in the country. We then set out to provide a one-time free comprehensive dental care program to honor our veterans. The rationale is that this gives our veterans a fighting chance to attain good oral health, which has been shown to have a strong correlation to attaining overall health. Besides, our combat veterans deserve it for what they did for the country. It is now our turn to serve those who've served so honorably. To have repeated success, we have to be on the same page with both the dentists and the veterans. For the volunteer dentists who want to give back to veterans and provide free dental care, our guidelines are, they will be assigned one veteran a year unless requested otherwise. And we do have several dentists who do that, who want to see more than one veteran a year. And the treatment involves eliminating infection and inflammation, establishing adequate function, establishing adequate aesthetics. And for the continuing care, if agreeable, the veteran can stay and be a paying patient and can establish that as their dental home. For any dental work to hold up, we know that certain factors need to be in place. Otherwise, we will be repeating all the work within a short period of time. Dental plaque or bacteria is the etiologic factor of all dental diseases. The two ways to control that are to attain good oral hygiene and have regular cleanings or maintenance. On my volunteer trips or in the outreach clinics, there will always be an occasionally healthy mouth, and on questioning, the answer would always be that they did understand and practice good oral hygiene of brushing and flossing regularly, and they came back for cleanings. These are emphasized to our eligible veterans right from the beginning in our program and throughout. Our veterans are actually really quite appreciative of the information we share regarding their role in preserving the dental care provided. So a good veteran dental care candidate would have these qualities. They understand and strive to practice good oral hygiene. They have to show up on time for all appointments. We encourage them to quit smoking. They have medical support for good control of their systemic health, and VA provides great medical assistance to them. And we emphasize that they continue with maintenance. Because good oral hygiene is such a crucial factor in attaining and establishing oral health, we want to try and mitigate other aspects that would diminish good oral habits. Stress is a significant presence in our veteran population. Contrary to the CareQuest white paper, our population, there's approximately 90% of our veterans suffer from some level of PTSD, depression, anxiety, or traumatic brain injury, or in many situations, a combination of these. Many of them have overcome drug and alcohol problems and had or still have mental health treatment in a rather good state when applying for or completing the applications with us. So inadvertently, a natural screening process for candidates whose stress level is more managed. Also in this population, we have approximately 90% of our veterans with some form of periodontal disease. As you can see, many studies have been done to show the correlation between stress and increased periodontal disease, as shown in the systematic review by Peruzzo, Benatti et al. And in a more recent review in October of 2020, where Zheng and Gang et al. Showed in their review and meta-analysis that periodontal disease was positively associated with depression and significantly correlated with anxiety. So how does this happen? In this educational article in 2018, Gunapin and Dirachi et al. Aim to review the results of research on impact of chronic stress on periodontal health. This is a simple diagram of the complex physiological responses and interactions in the biological mechanisms and behaviors linking stress and periodontal disease. There are several pathways. The stress activates the hypothalamic, pituitary, and adrenal axis, resulting in the increased secretion of cortisol and glucocorticoid hormones. These glucocorticoids induce changes in the inflammatory response, changes in levels of biomarkers, causing reduced host response and promoting chronic inflammatory change within the periodontum. In the autonomic nervous pathway, stress results in the release of catecholamines like epinephrine and norepinephrine. And there are various neuropeptides that are released by nerve fibers. These alter blood glucose levels and immune response that increase the susceptibility of periodontal disease and also poor healing of treatment responses. Stress has also been shown to affect behavior changes where motivation declines, oral hygiene habits deteriorate, and there's more likelihood for smoking and alcohol consumption, poor diet, bruxism, occlusal trauma, which contributes to periodontal disease progression. So addressing psychological factors such as stress and depression is an integral part of optimal dental treatment and prevention. In addition to having good oral hygiene, we have to address the factors that exacerbate dental diseases. We talked about the biological and behavioral pathways just now, and I want to point out the potentially damaging oral effects of psychotropics. Dry mouth is a common side effect of this medication, and a lot of our veterans have multiple medications for that. And dry mouth has been documented to contribute to rampant tooth decay, especially root decay, and periodontal susceptibility. Preventative measures of oral moisturizers and mineralization with fluoride are crucial for prevention. For my medical colleagues, if I could chirp in your ear, to please always be vigilant about this when prescribing these medications. When appropriate, we encourage veterans to have psychological and psychiatric care from the VA to reduce stress. However, we notice there are stressors that the VA cannot step in easily to help, but that can be readily managed by volunteers. With that in mind, we launched the Wingman program, where veterans are asked about other major stressors in their life, and our Wingman volunteers work to alleviate them. Jessica will explain more later in this session. So just knowing that they are getting comprehensive care, that itself has often been reported as, quote, a huge weight off my shoulders and a huge anxiety reducer. Or when their spouses are eligible for dental care due to their qualification, they're so proud to be able to, quote, provide that for their partner. And these are also helpful in reducing stress. So in supporting them to get maintenance care after comprehensive dental work is completed, we impress on them the significance to plan on 1 or 2 cleanings a year and take care of other incidental dental needs. So we encourage them to utilize free dental care events, sliding scale clinics, get on Medicaid or their VA dental insurance to accomplish these. Sorry, Jessica is running the slide for me. The ultimate goal of comprehensive care is that we could promote oral health and overall health, as in this diagram, by keeping our veterans within these 2 paths. The inner circle is the treatment path, and the outer circle is the maintenance path. And for some veterans, if they get to us earlier and try to establish dental health, they and not needing all the comprehensive care, and they can just stay in kind of the maintenance path. We work to have our veterans not go off these 2 paths, so where their dental condition will deteriorate. In summary, I would like to highlight some of our preliminary conclusions, and with further investigations and larger amount of data may contribute to solutions that advance health equity for veterans. Everyone for Veterans is a 501c nonprofit program specifically dedicated to connecting veterans to comprehensive dental care around the country. This can be one of many approaches to address veteran oral health access and equity. In promoting comprehensive dental care, this is by no means minimizing urgent care needs model. I feel this is very much complementary to the larger existing urgent care delivery model. As we all know, our veterans' dental access issue is significant. So in this population we serve with financial challenges, pro bono comprehensive dental care can be an option to, quote, stop the bleeding, shall we say, and then, can help reduce the amount of dental disease that need to be addressed in the future. I'm aware that not all veterans want comprehensive dental care. Some just want to have their urgent needs taken care of, so both models are needed to provide dental access. For the sustainability, as you have seen, we need the partnership of our veterans. The restorations we do, the periodontal surgeries we do, the implant surgeries we do, will only hold up if adequate home care and maintenance care are in place. It is imperative to establish the partnership and responsibility of our veteran patients and have them realize that they hold the key to better oral health after comprehensive care is provided. We look forward to the understanding and involvement of all stakeholders in the well-being of veterans, from their physicians to counselors, behavioral health specialists, to the physical therapist, all the dental staff, to include and emphasize good oral hygiene and minimize stress in order to support overall health. Our program depends on the volunteerism of dentists and Wingman volunteers to achieve oral health and overall health, to improve the quality of life of veterans. So please join us if you're a dentist on this platform. Automation is great, and we try to put that in place as much as possible. But just like in our practices, achieving healthy dental status will still require some people connection, where our program manager and staff needs to follow up, manage the veteran patients and dentist questions. So these all require funding, even though we do not work in a clinical setting. With providing comprehensive dental care, the number of veterans we treat are naturally less than in urgent care model. This has provided some challenges for us. As funders obviously would like to see more veterans' health, and we would like to do that too. I hope this is helpful in illustrating the need to also expand to a comprehensive dental care model to address veteran dental access, and we hope for your support. Our preliminary survey of veteran maintenance compliance is about 50%, which is quite good compared to a range of 30 to 50% in private practices. But more data still needed to be done to be more prudent about it. So in areas of significant capacity where many veterans sign up to care for veterans through Everyone for Veterans, we have a program to include non-combat veterans. So this is progress. So with that, I will wrap up my section here, and Jessica will continue with this presentation. Thank you.
Thank you. Today, Dr. Chang has shared with you the why of why we do this work. It is now my privilege to share with you the how we put our mission into movement. This begins with our staff and leadership. When Dr. Chang began this work, she was a practicing periodontist in Issaquah, Washington. She had no experience with the military, but saw a critical need and decided to do what she could by saying yes. Yes to helping our nation's combat veterans. Fast forward to today, and that yes has become Everyone for Veterans, a 501c3 charity founded in 2017, serving veterans across the nation. Our staff and leadership are dedicated to serving veterans and valuing their unique experience. Our dental program manager was raised on Air Force bases around the world. I am the daughter of veterans, and 50% of our board are veterans or veteran spouses. As an organization, we are guided by our lived experience, and we are dedicated to improving the lives of those who have served. The veterans that we work with come to us through a variety of channels. The main recruitment areas are word of mouth, VA and vet center referrals, and online search for dental care. We serve veterans that have deployed to combat or imminent danger areas, are experiencing significant financial hardship, and have limited or no dental insurance. We also provide services to spouses and minor children of eligible veterans and veterans that have experienced military sexual trauma. The combat veterans that we work with are experiencing significant financial hardship, generational and systemic poverty, and often employment barriers due to mental health challenges. Our combat veterans have often described returning to civilian life as more difficult than combat itself. While our organization does not specifically serve persons experiencing homelessness, it is important to note that as many as 1 in 3 homeless men have worn a uniform. Combat veterans experience higher rates of PTSD, joblessness, and suicide. Because of this, our approach to serving these veterans must be compassionate and tailored to their unique experience. Once a veteran is referred to us, they submit an application through our website. We screen these applicants through a thorough intake interview and review of documents. During their interview, their preliminary dental concerns are discussed and a detailed history is reviewed. Potential challenges for treatment are explained, such as possible triggering experiences like bright lights and loud sounds during their course of treatment. By actively communicating with the veteran and learning about their unique situation and any PTSD, MST, or TBI challenges, we're able to help prepare both them and the dentist that they're working with to make sure that this is a comfortable and positive experience for all. Once a veteran is qualified in our program, they become a new dental client, and our team begins the process of recruiting and assigning volunteer dentists in their local community. Once a local dentist is found, our team sends the mission sheet with information about the veteran that they will be seeing, including a disclosure of relevant information to help serve the veteran and the dentist that they are working together with. Once the veteran is assigned, we follow up with them and the dental office to provide support as needed. Our staff walks alongside the volunteer dentist every step of the way, answering questions, providing support, and often acting as a liaison between the veteran and the dental office. Everyone for Veterans partners with a network of more than 560 volunteer dentists and 3 dental schools around the country. Dentists come through us with a variety of ways, often through peer referrals and dental society publications. Volunteer dentists sign up on our website and receive a welcome packet of materials from our dental program manager to make sure that their first mission is successful. They will be called once we have a veteran in need in their community, and their first dental mission will be assigned. Once assigned, the veteran will work with the partnering dentist, as well as the dental staff who are vital in supporting good oral hygiene. All veterans must sign an agreement and release with Everyone for Veterans. This agreement outlines program expectations. The foundation of this agreement is communication. We communicate clear expectations, outline our cancellation policy and potential grounds for disqualification, as well as an emphasis on the importance of proper oral hygiene and follow-up care once they complete treatment with Everyone for Veterans. This foundation of communication is the bedrock of our dental and Wingman programs. These programs are covered by our staff, volunteers that are supporting the veterans each step of their treatment journey. I've shared with you that many combat veterans have described returning to civilian life as more difficult than combat itself. The transition to civilian life can be challenging, and navigating community resources can be overwhelming. Through our conversations with veterans in our dental program and identifying other stressors that are impacting their well-being, the Everyone for Veteran Wingman program was born. Our Wingman program comes from the Air Force concept of providing protective support for the lead aircraft. This is what our network of Wingman volunteers do each day. We provide protective support to the veterans that we work with by providing resource navigation, tangible goods, and other practical support to improve the veteran's quality of life. Some examples include securing resources to provide veterinary care for a veteran's service dog and providing warm weather clothing and gifts for children of veterans during the holiday season. By walking alongside them through their dental care and offering wraparound supports and gap services, we are meeting the needs of the whole person. This helps them to feel supported by their local community and eases the transition to civilian life while improving their overall quality of life. To illustrate how these programs work together in concert, I would like to share with you Christoph's story. When Christoph came to Everyone for Veterans, he was dealing with severe chronic pain that impacted all aspects of his life. He was sleeping on a sofa and working a number of part-time jobs, including driving for Uber just to make ends meet. We were able to assign Christoph a volunteer dentist in his community that began to restore adequate function, relieve pain and infection, and establish adequate aesthetics. While working with our team, he disclosed that his sleep situation was not optimal. We were able to connect him with a Wingman volunteer that provided a new bed frame and mattress for him. Now that his dental treatment is complete and he is sleeping comfortably, his life has changed. He is able to become a full-time teacher, active member of his community, and now that he is well rested and pain-free, he's able to be the engaged father that he has longed to be. Today, we would like to share a video with you where Christoph shares in his own words the difference that this program has made in his life.
Good morning. My name is Christophe Drouet. I was in the U.S. Army for almost 11 years. I started as an enlisted, was commissioned shortly after the Twin Towers fell, and as a result was stationed in various places around the world, including the nice places like Germany and Holland, but also I was operational in Kuwait, in Iraq, operational IF. I became injured and I had big problems with, I came back like 3 years ago to the United States. I was injured. I was not in a good place because also terrible tooth problems that I accumulated since I didn't see any dentist since I left the U.S. Army. My teeth were all rotten down to the bone, and I was suffering excruciating pain, and it was I couldn't even eat on both sides of my mouth with large gap. I even had to extract a tooth myself of waiting to go on missions, and it was a horrendous experience. I suffered really bad problems, down to the point where it was preventing me to get proper sleep, had continuous headaches, disrupting my train of thoughts, and I found it very hard. I came back to the U.S. I got a MBA using my GI Bill, but I've been in a very precarious situation, and my tooth problem was down to it was down to the point where I didn't know what to do anymore. I mean, I could just witness myself going down physically. It was affecting every other parts of my body. That's when Everyone for Veterans came about. They gave me an extraordinary through the Wingman program. So I strongly believe that this program should be extended because it's changed my life, literally. I can't say thank you enough. Very important things to help me out. Allows me to be a better teacher, which I'm doing obviously here now, and a better father, and allows me to progress in my life very significantly to the benefit of myself and my family and my son. So thank you again, Everyone's for Veteran. You guys rock, okay? And I hope you can help a lot more veterans like me.
Improving the quality of life of our veterans and their families is at the forefront of our concern. Bryant S., an Operation Enduring Freedom veteran, shared this update with us following the comprehensive dental care that he received. Because I didn't take care of myself due to everything I went through, I have expressed to my kids how bad it can get if they do not brush their teeth. I also explained to them how painful it can be to get everything that I had done, and that has made my kids brush their teeth every morning and every night before bed. They all got new toothbrushes and toothpaste, and they brush 2 to 3 times a day. My youngest stays in there for about 3 minutes brushing hers. The dentist that worked with Bryant provided more than $20,000 in comprehensive care. This investment has changed the oral health trajectory of Bryant's entire family and created new healthy habits for his children that will last a lifetime. This model supports sustainability by breaking the cycle of poor oral health and lack of oral health instruction. Throughout our dental missions, our staff provides assistance to volunteer dentists, much like the Wingman provides help to the veterans, protective support, and navigating every step of the way. Once treatment is complete, we follow up with the veteran and the dentist to ensure that expectations were met or exceeded by both parties. A patient ledger of services donated is received, survey data is collected, and the dental mission is closed. At this point, the dentist is now ready to take on a new dental mission in the time frame of their choice that fits their schedule. This year, Everyone for Veterans is celebrating our 5-year anniversary. In the last 5 years, we have been able to provide more than $975,000 in services and supports to veterans and their families through our dental and Wingman programs. This is with a network of more than 560 dentists and 110 Wingman volunteers across 35 states. Each year, the veterans and spouses that we serve receive an average of $3,500 in-kind comprehensive dental care per mission. As we look ahead, we are encouraged and inspired to explore even more opportunities for equity and access to the veterans that we serve. There are many ways that you can partner with Everyone for Veterans to improve the quality of life of our nation's heroes. Our nonprofit organization does not receive government support to do this work. Our mission is put into movement by the generosity of individuals and corporate partners. We invite you to partner with us today. A link to our donation platform will be posted in the comments. Additionally, we would encourage you to learn more about joining our board of directors, becoming a Wingman volunteer, or a partnering dentist. Please reach out to Dr. Chang or myself with any questions. Thank you so much for joining us this morning. We are both grateful for the opportunity to be a part of this colloquium, and at this time, we would like to answer any questions that you may have.
So I see Carol's question. Sean, can I just jump in?
Oh, please go right ahead.
I see Carol's question about how long is the application process. So it can be as quick as even 2 weeks. The factors that are involved are, if the veterans get their information to us, or they respond to our phone calls, and then also if there's a dentist in that area, a volunteer dentist already that's open. And so, so it can be as quick as 2 weeks. And then I think the delays that show up are really because if there's not a dentist in the area where the veteran is at, and then we have to actively seek, call, and such, and then it can take longer. So our longest wait could be even a year, but those are very, very small numbers. Most of them are, processed much faster than that. But so we need dentists to sign up. I hope that answers your question, Carol. Oh, yeah, I see. Okay.
And Dr. Chang, I see that you answered the question around the psychotropics, but wanted to give the entire audience who might not be as adept at the chat to see if you have any additional comments. Specifically, I noticed you said look, psychotropics are notorious for it, but there are some other medications. So maybe you could talk about a couple more of those and implore the audience to double check those prescriptions.
Yeah. So the question was, any data about, psychotropics and dry mouth. And so I think there's a lot of articles on that. And I did add one in the chat. And so I didn't mean to imply that psychotropics are the only medication that produces dry mouth. A lot of medications do. And so, but the psychotropics is maybe a little bit more loud in that aspect. And so on top of that, it does promote significant dry mouth.
So a comment that just came in from Dr. Geierman really centers around advocacy. So I'll try to form it in a question for both you and Jessica. When you think about advocacy, because we heard a lot about that with the first session this morning, what are some things that advocates could do that could help programs like yours become more successful? And maybe a clinical response from you, Dr. Chang, and Jessica, more from the programmatic management aspect of things.
Sure. Thank you for the question, Steve. And Fred Levinton and I have had conversations, and so there's a lot of similarities, but you can tell, because we concentrate on working with veterans, we do, more of the addressing all the issues around this specific population, the stress management and such. And so So there's some similarity there. I totally agree. Volunteerism is not the way to go as far as to take care of the veteran issue access issue, because that's huge. However, I do feel like a combination of that, where the VA system may need to address all veterans, but like Dr. Trapp had mentioned, a case could be $120,000, right? So I think the VA may need to step up and provide. This is my thinking. They provide care for all veterans, but maybe, at a certain level, as far as kind of like the basic level. And then anything additional to that may be still something that, volunteer programs or, citizens want to give back to veterans. And so a combination of something like that. I hope that answers your question.
And I would also add that the value that comes from the volunteer aspect can also be vital in helping the veteran to feel appreciated and welcome at home. Receiving the services that they should be receiving from the government, of course, is vital to their long-term health outcomes. But knowing that someone in their community is stepping up to stand alongside them and walk with them through every step of their recovery journey is also important to treating that whole person and really helping them feel more at home as they're transitioning back into civilian life.
Thanks, Jessica. 2 more questions came in. One, I'm hoping for a short response, and then the second one I'll ask maybe a little longer. But the first one is, do you all treat homeless veterans as part of the program?
Homeless patients oftentimes don't find us. Our application. So our application is online, and a lot of times they don't have that ability. And on top of that, the homeless veterans, a lot of times they have a whole other set of, issues. And so dental care is probably not their priority. And so inadvertently, we're not opposed to seeing homeless veterans. We've had homeless veterans that we can help, but the majority are not homeless veterans.
Okay, and the next question, which I'll pose to both of you, and feel free to jump in. How important is patient education or personal oral awareness to improving the veteran outcome? If so, is this done a certain way through your program? Basically, is prevention a large part of the focus, or how do you make it a large part of the focus through Everyone for Veterans?
I guess that's where the periodontist part comes in and cause trouble. Okay, so the prevention and is huge as far as our program, and so like I mentioned, getting good oral hygiene and is very important to us. So our program manager is my old dental assistant, so she knows that I am a stickler with that, and so we are always improving that aspect of it. And so at this point, it is something that we emphasize to the dentist and to the veteran.
Thank you so much.
We are at time.
Oh, sorry, Sean. We're out of time. I'm putting some of this in the chat. We have about a minute before we need to transition, to our next session. So I put the CEU code in the chat, and my thanks to both Dr. Chang and Ms. Elwell. What a fabulous program.